Hi, good afternoon. This is Dr. Butch Levy. My topic for today is concerning cognitive decline, memory loss, and Alzheimer's. Until recently, it was really felt that once people started that downward slide toward Alzheimer's and the loss of their memory and their recall, there wasn't much that could be done. We certainly, for a long time, tried to research and give drugs that would help the brain function better and prevent it from progressing, but it appears that conventional medical therapy has been very limited, if help at all. What's going on now is that people are recognizing that this has really changed. That what's changed is there are new theories and constructs that are going to replace the old medical model with one that involves a much more holistic approach to correcting problems related to the brain. The brain is really interested in maintaining a sharp level of focus and attention and organization and learning new things. And it doesn't ever have to decline if we treat it correctly. What we've discovered is that aging does not cause the brain to lose cells and not be able to work effectively, but rather how we treat it. What things are we doing that are causing it to decline and lose its ability to maintain? Well, we'll discuss a little bit about this. Most of the research has come from Dr. Dale Bredesen, a research clinical doctor at UCLA. Following his work and his clinical applications of what he is seeing as the corrective measures has produced some really amazing results for people that have cognitive decline and early Alzheimer's. Adding this to my own practice, I've been astounded at the level of improvement people can make, but it takes a great deal of discipline and persistence. It usually requires that you have a significant other or a coach that can help you follow through with all the things that I'm going to talk about. But with that, if these are put into place correctly, people really respond and do very well. So the things that we really focus on are correcting your blood sugar. Blood sugar really affects insulin levels and inflammation is probably the major factor for brain dysfunction because it results in oxidative stress or damage to the cells, and persistent inflammation causes persistent oxidative stress. So getting the blood sugar corrected will reduce inflammation and oxidative stress, as will balancing your hormones, which would require that your adrenals, your thyroid, your estrogen, your testosterone all be optimized. Doesn't mean it has to be really high or really low, but in a range that works. The other things that are really important is to get some genetic testing and make sure you don't have a predisposition like ApoE4, which is a lipid parameter that really is synonymous with expecting to have Alzheimer's down the road. This can be corrected, but you have to know about it in order to be able to work on it. The other thing you need to do is really get your diet fine-tuned and optimized. Off the sugars, off the processed foods, eating organically to get away from all the things that are sprayed and put in the soil for our foods. What we know is the toxic exposure is a huge level of inflammation and oxidative stress on the body, whether it be pesticides or insecticides or petrochemicals in the environment from gas fumes and diesel fumes, or heavy metals from things like arsenic in the soil that goes into our rice, or mercury that comes from coal-fired power plants. Or what about fragrances that are on everything that we buy, which all have a level of toxic plasticizers that can really affect us, or solvents when we clean. All of these things, when really looked at and assessed, can be eliminated and corrected by detoxification. The other things that are very important are making sure you get the right supplementation to correct any depletions that have gone on in the body, which usually is done by following specific laboratory testing that can help us know what things you really need. And the other thing is we have chronic infections that remain active in our body. We have Epstein-Barr, we have herpes, other herpes viruses. We have bacterial infections that have remained after we've had pneumonia or sinus infections. Things like Lyme disease play a significant role. But what we've discovered there are these dozens of different factors that play a role in how well our brain functions. And in order to maintain connectivity between our organizing and recall factors and our visual and hearing faculties and our emotional faculties, all of these have to be functioning, and we want to stimulate new growth and new connections, which when you provide the right environment by following these protocols really makes a difference, and you can change the way your brain works. There is no doubt. The other things that play a significant role are following through with brain exercises. Just like you'd go to the gym to get the biceps and the quads all worked up, there are scientific companies that are producing brain exercise programs that are fun and stimulate different areas of your brain to respond and develop new connections and work harder to learn and develop. So I've had great responses to my patients following these protocols. They certainly take 2 to 3 to 6 months to really be able to be implemented and see changes in how the brain works, but they do work. And I would recommend that if you want to come in and talk about it, come in for a consult. I'd be happy to see you. Otherwise, there are lots of other doctors around that have been trained in this, and it's really important that you, your spouse, your family members that are being impacted by recall problems, memory issues, early Alzheimer's, please get help, because there's no longer the same game anymore. The medical theories that used to exist are being tossed out, and the newer concepts are coming in, and we're going to see a major change if people are willing to go for it. And I would say you got nothing to lose except maybe some of your loss of memory or your lack of quality of life that you've wanted to have. So please, follow the advice and at least look at it further. Thanks.